I think you're already seeing some signals in terms of some committees that are popping up and some comments by the leaders. Let's talk about some of those and walk through them, what we're already seeing. Both the president and the speaker are saying, you know, the election's over, Obamacare is the law of the land, and we got to deal with it. But what are the big issues around Obamacare?
Yeah, and that in itself is sort of interesting in that with the election, the re-election of President Obama, there's no hope really for repeal of the federal health care law. So the fact that the leadership, the Republican leadership in Florida, not just incoming Senate President Gates and incoming House Speaker Weatherford, but also Governor Rick Scott, have essentially acknowledged that, okay, now we got to deal with this. It's the law of the land, and it's time to stop fighting it and start trying to figure out. Gates said, which I thought it was very smart of him to say, you know, look, I'm not interested anymore in fighting this battle. It's over. We've got to come up with creative ways to deal with the healthcare law. Federal healthcare law goes into effect soon, and Florida's already missed one deadline. They can't create this health exchange, which is sort of a marketplace to help people buy health insurance, because there's going to now be a requirement that they do so. So the feds are going to, at least at the start, are going to set that up for Florida, because Florida missed the deadline for doing it while Florida was fighting, you know, hoping that they wouldn't have to do it. But now everybody seems to be saying, okay, we're going to have to try to figure out how to do this. Gates put a little bit of ink where his mouth was in saying, so by creating a committee, he wants a joint select committee on the Affordable Health Care Act, presumably to try to work through some of these issues. Governor Scott knows that part of the issue is the state is going to have to expand Medicaid.
And that's a big ticket item.
Yeah, that's a huge cost. And so this is a real issue. This is not just, you know, sort of arguing the finer points of how healthcare is delivered. We're talking big money here. And there is going to be a lot of discussion, I think, this session over exactly how you do that. Governor Scott has already thrown out sort of, you know, some things that Florida was already looking about putting Medicaid patients into managed care as a way of sort of throwing a bone to the feds and saying, you know, maybe we could do this, and, you know, we could get closer to where you want us to be. You let us get closer to where we want to be. So they're already talking compromise.
A lot of the expanded coverage of Obamacare depends on a dramatic expansion of who's covered under Medicaid, correct?
That's right.
But they do say from the federal level that there will be increased funding for a period of time, correct?
Yeah, the feds will pick up, in fact, the whole cost at first, but eventually some of that cost will shift to the states, and down the road, that's a huge concern for Florida. Of course, the economy's starting to come back, and tax collections should start to increase. We've been in this 4-year period where, you know, any talk of increased cost was nightmarish, compounded, because not only would the cost go up, but tax collections have been dropping and dropping and dropping. Well, it looks like we're on the rebound now. You know, the tax collections are expected to come in a little stronger over the next few years, and as the economy improves, there'll be more money. But Medicaid has always been a big cost driver and a big problem financially for the state.